Nursing started before the Middle Ages, and as such has been known. Sorry, and as such is probably one of the uh, and as such is probably one of the oldest known professions, and has changed drastically throughout history. Some of the notable changes are education, the duties and responsibilities, and salary and benefits. The earliest recorded nursing is around the Middle Ages. According to Nursing World Hub, in the Middle Ages, nursing was largely based on religion. Many of these were volunteers or wards of the church, and they were nuns or monks. Many of these volunteers were unpaid and they had to work for up to 12 hours, and they were also untrained. Most of these had little to no training and low supervision, so they were able to practice pretty much freely. Despite how we see nurses today, nurses back then were considered low society and many were disrespected. In the Middle Ages, primarily many of the nurses worked in monasteries that held hospitals. In the 500s and 600s, the first Spanish hospital arose, with many of its nurses being provided by the church. Uh, they were told to provide care despite nation of origin or religion, and they had to provide care for patients who were ill or injured and also who had leprosy. Nursing changed drastically throughout history by one woman, Florence Nightingale. According to Nursing World Hub, nursing education and procedures relied greatly on Florence Nightingale's experiences and techniques. She was mainly known for improving sanitation and decreasing the death rate by 2/3 in the Korean War. She opened the first nursing school in London, known as the Florence Nightingale School for Nurses, in 1860. She paved the road to modern procedures in caring for our patients. According to Scrubs magazine, the list for duties for nurses in 1887, nurses had to provide care for 50 patients along with normal duties like taking care of daily cleaning of the patient wards, sweeping, mopping, cleaning the chimneys. They also had to keep the patient wards at an even temperature by bringing coal daily. Day nurses had to be in by 7 a.m. and out at 8 p.m., except for on the day of the Sabbath. Nurses could expect to make around $1,400 a year, and nurses had to set aside a good sum of her wages so she would not be a burden during the declining years. So if she made $30 throughout the week, she would have to set aside $15. And any nurse serving faithfully and without fault for a 5-year period gets a 5-cent pay raise. Just over 200 years, nurses have faced tremendous obstacles and have exceeded tremendously. According to the American Nursing Association, nursing is the protection, promotion, optimization of health and abilities, prevention of illness, and alleviation of suffering through diagnosis and treatment of human responses and advocacy of healthcare for individuals, families, communities, and populations. Modern nurses have many options as far as furthering their degrees. The most common is a 3-year study degree and on-site hospital training, which is also the oldest degree. But nurses can also further the degree, getting an associate, a master's, bachelor's, or even doctorate degree. According to Nursing World, nursing responsibilities include, but are not limited to, performing physical exams and health history, and providing promotion, counseling, and education. Nurses are also responsible for discussing with physicians and evaluating a personalized care plan. According to pay scale, new nurses as investigators can time off, health and life insurance, and retirement. Pay benefits can be affected by education and skill level as well as work performed, and they can also be affected by location and possibility. Being one of the oldest professions, it makes sense that it's the most change and most benefit. Next time you visit the doctor's office or the hospital, remember how far nursing has come. From untrained, unpaid volunteers to low-educated nursing doing off-season work along with their normal responsibilities, and now the well-educated nurses who focus on the well-being of their patients. Nursing will continue to change throughout time. We will always expand our education, find better ways to care for our patients through daily responsibilities